So to start off the second part of the afternoon session, I'd like to welcome my colleague Rachel from CFE Research. So with no further ado, Rachel, I'll hand over to you. I'll just make you the presenter now.
Great, thanks Beth. And good afternoon everyone. I'm Rachel Morton. I'm Associate Director at CFE Research. I've been working on the Fulfilling Lives National Evaluation for 7 years now, I think it is. One of the reasons that we wanted to do today's session on workforce development was because it's a topic we've been looking at over the past few months, and all being well, we're going to publish a series of briefings on different aspects of workforce development and multiple disadvantage. And one of the things we were thinking about in putting together that piece of work was the importance of covering all different aspects of the workforce. And so this final session, we're going to be looking at the role of commissioners and policymakers. As part of our study on workforce development, we thought it was really important to recognise that actually commissioners, funders, policymakers are also a really important part of the workforce whose work affects people affected by multiple disadvantage. And we know that Fulfilling Lives partnerships have sought to work closely with commissioners and policymakers as part of their aim to create lasting systems change. So what we were aiming to do with this aspect of our work was to explore what commissioners and policymakers say they need to help them make effective decisions, but taking into account some of the many pressures and competing priorities that they often face, but also to understand the different activities and approaches that Fulfilling Lives partnerships have taken that have been useful in building relationships with commissioners and policymakers. We've heard a lot today about the importance of developing relationships. So I'm going to, a bit like my colleague Jo did earlier, I'm going to give a very brief overview of our key findings and really set things up for our final two speakers of the day. So, what do commissioners and policymakers need? The first point is possibly a little bit obvious to start with, but they need really good knowledge of the range and complexity of issues that people facing multiple disadvantage are experiencing. They need this obviously to ensure that any services and support they are designing, commissioning are appropriate and sufficiently flexible to really meet the needs of people experiencing multiple disadvantage. If you joined us for this morning's webinar, you'll have heard about the navigator role. So, for example, if you're commissioning a navigator service, it's really important that you understand the details of just what that means and that there's sufficient resource to ensure it's delivered effectively. Equally, you'll have heard that the importance of navigators working to support beneficiaries to work towards their own goals. So while we recognise that sometimes key performance indicators may be necessary, these need to be realistic and not get in the way of a person-centred approach, but rather support that. So, of course, key way to ensure that services are appropriate is to co-produce them with the people who are going to be using them, with people with lived experience of multiple disadvantage. And we'll hear from our next two speakers and our final speaker in particular about working with service users to co-design services. So it's important that policymakers understand the value of co-production and have the the knowledge to understand how to do it effectively and the resources and time that's required. Evidence-based policymaking is something that I think is well established now as a goal that we should all be striving towards. We found, as part of our study, a real appetite among commissioners for good quality evidence that would help them make confident and informed decisions. But we also need to recognise that, like many others, they are often time poor. So that evidence needs to be presented in a way that is easy to find, easy to pick up, make sense of, can easily identify those elements that are relevant to them and their particular concerns or challenges or issues that they're looking at, and offer some sort of practical recommendations that can be used. And finally, one of the challenges, I suppose, that Fulfilling Lives programme is seeking to overcome is what is often described as a sort of silo working. And we think that commissioners and policymakers have a role to play here. So partnerships really emphasise the importance of systems thinking in this regard, and in particular focusing not just on individual services or even a whole collection of individual services, but the interfaces between them and how those services link to each other, work alongside each other, and how people move between them. So our evidence from our evaluation really shows that it's often in those gaps between services, the transition between services as well, that where people are experiencing multiple disadvantage or often failed. And we're about to kick off a study looking at just one of those transitions and prison release. So systems thinking is a way of exploring and developing effective approaches by looking at connected wholes and not separate parts of a system. And it's something we held a webinar on earlier this year on the topic. And hopefully you can go back and watch that on YouTube as well. Beth, I'm sure you'll correct me if I'm wrong. But we also highlight some useful resources around systems thinking in the briefing that we're about to publish. I mentioned that our work on this topic has two aims, and the second is to explore how fulfilling lives partnerships have worked effectively with policymakers and commissioners and what they found as useful. One of the themes that comes up time and time again, I found in the programme, is this idea of multi-agency meetings or groups or forums, got various names and acronyms across the country, different formats and purposes in some cases, but this bringing together of people in different roles from different sectors and specialisms and different services seems to be playing a really important role in overcoming some of those challenges around silo working or atomizing of different elements of what ideally should work as a coherent system. So these have been a really valuable way to build and strengthen those relationships that are so important. I guess part of the challenge is selling the purpose and value of attending groups and meetings, particularly making sure that you've got the whole of the sector and all the different services and specialisms that you'd want to be there involved and engaged and committed. One of the things I think that we've seen that's been really encouraging as a result or byproduct, if you like, of the pandemic restrictions and moving groups and meetings online is that some partnerships have reported seeing improved attendance. People don't need to make time to travel. It's much more easier to get involved. So it'd be good to see that continue. And I love the idea that Rebecca mentioned earlier about assertive outreach to stakeholders as well. I mentioned the importance of accessible evidence. This is something that at CFE we've been really thinking hard about in the last few years, and we know partnerships have been doing the same. So it's thinking about how we can provide evidence in an accessible format as possible. Here I really like the concept of sort of layered communications. So this could be something very short and high level, could be the traditional executive summary, I guess, that's easy to read and digest and you get all the key messages, but it could be an infographic, a poster, even a series of tweets. So to get out those key messages, but also to whet the appetite for more information. And then that can be supplemented with a more detailed report, that's something that's still plain English and succinct. And then layered on top of that, something a bit more specialist for those who really want to understand in detail how the evidence was arrived at, and allows you to sort of dive into the data if that's your particular interest. Fulfilling Lives Partnerships and other similar organisations working with people facing multiple disadvantage have lots of expertise, and we've seen that reflected in the presentations today. So it's important to be able to create opportunities such as a practice development unit to share that with policymakers and commissioners, whether that's events like today's webinar, training, multi-agency groups and so forth. And we're going to hear from the next speaker about how they've benefited from working closely with Fulfilling Lives in designing a psychologically informed environment. Move on to the next slide. I also highlighted the importance of co-production earlier, and one of the ways that Fulfilling Lives partnerships have been really valuable is brokering introductions between their lived experience groups and service providers and policymakers, and providing support and guidance on doing effective co-production. So at the national level in particular, for example, we've seen the National Expert Citizens Group, a bit of a spin-off group from Fulfilling Lives, doing really great work with policymakers from central government departments and agencies. And it's interesting, Felipe highlighted the role of Fulfilling Lives in training and supporting experts so that they can make a meaningful contribution to co-production. But I think what we've gathered as well from the work with commissioners and policymakers is it works both ways. And actually sometimes policymakers may need some support and training to help them work effectively with experts and get the best out of that process. And finally, I think whether you're working with people with lived experience or senior policymakers, we need to be aware of the impact, I think, of power dynamics. And there's a really nice example in the piece of work that we're going to be publishing shortly of an example of a partnership providing very informal opportunities for Fulfilling Lives staff experts and commissioners to come together, not necessarily with a specific agenda, but in an informal setting to share learning and experiences, to chat and get to know each other a bit better, and to explore some of the challenges and issues and learning. And if you were on the session this morning, you'll have heard about reflective practice. So I'd be interested to know about how we can use reflective practice, but with policymakers or funders and so forth. I think we could all, and I include evaluators and researchers like myself in that, benefit from trying to carve out the time to stop, reflect, take stock and think about what we're doing and how we can always move forward and work better. So I'm going to leave you with that final thought and pass you back to Beth to introduce our two main speakers of the afternoon.
Brilliant. Thank you, Rachel, for that fabulous overview of the work and, yeah, good contextual underpinning for the next two presentations. So we're going to be joined this afternoon by two commissioning officers. I'm next going to hand over to Carl. Carl is a commissioning officer based in Newcastle and Gateshead. So with no further ado, I'll hand over to you, Carl.
Thank you very much, Beth. Hopefully everybody can hear me. I'll switch my video off if there's some audio problems.
Yeah, it's all good at my end. Thank you.
Okay, great. Thank you. So, yes, today I'm going to talk about psychologically informed environments, or PI, and this is a partnership with Fulfilling Lives to provide an effective system of support for multiple disadvantage. And as Beth said, my name is Carl Taylor. I'm a commissioning officer at Gateshead Council. Next slide, please, Beth. So just a bit of context for you, for people out there who maybe don't know very much about Gateshead. It's located on the south bank of the River Tyne, has a population of around 202,500 people, and it's estimated in 2016 that there were just over 90,500 households in the borough, and that's going to increase over the next 20 years. And by the ONS mid-year population estimates of 2018 and the DCLG household projections 2014. As I say, the population is due to increase by about nearly 8,500 up to 2041. So the population will be just over 210,000. The population is aging. I guess that's the case across the country, and it's projected that by 2041 there'll be an additional 12,100 people aged 65 or older, so it's an increase of 31%, and that's based on ONS 2016 subnational population projections. And it's estimated that around 3.7%, about 7,500 people in the population in Gateshead are from a black or minority ethnic group, and that's from the census, and that has increased slightly from the last census in 2001. Next slide, please, Beth. Thank you. And just a little bit more context. So in terms of deprivation, so Gateshead is the 47th most deprived local authority in England out of 317. About 32,700, about 16% of people in Gateshead live in one of the 10% of most deprived areas in England. Extending that range further, nearly 62,600, 31%, live in the 20% most deprived areas, and that data is from IMD in 2019. Much of the deprivation in Gateshead is located in the central and eastern urban areas of the borough, and we have 10 wards containing areas within the 10% most deprived in England, and 82% Felling Ward, which is in the east of Gateshead, is estimated to have the highest proportion of its population living in the 10% most deprived areas in England. And again, that's data from IMD in 2019. And finally, on context, 22.6% of children aged 0 to 15 are in poverty in Gateshead, and that's information that came from our own Public Health Fingertips tool. So that's a little bit of context. So in terms of strategic review for Fulfilling Lives in PI, so in 2016, Gateshead Council decided that a strategic review of all supported housing in Gateshead for homeless people with multiple disadvantage and complex needs should be undertaken with a view to recommissioning services. So as someone with a previous background in homelessness, I was given the task of completing the review, and I started to build working relationships and partnerships with key stakeholders, those being providers, clients, and the wider support community. Of course, I was eager to involve people with lived experience in the review, just to ensure that co-production was at its core. So to do this, I set up a co-production working group, which included clients with lived experience, and several workshops were arranged, hosted by a variety of our supported housing services. So we tried to move them around different supported housing sectors within the borough. Using existing data and information that was emerging from the workshops, it became clear to me that poor mental health and poor well-being was the most significant challenge facing the client group that we were looking to commission new services for. During the initial stages of the review, I was introduced to Fulfilling Lives as a vulnerable persons panel led by our homelessness team. And it was clear to me that the work Fulfilling Lives had started to undertake across Newcastle and Gateshead to tackle multiple disadvantage was not only impactful for clients, but could also help me with the review, could contribute to system change and potentially shape the design of future provision. Another key element of the review was further research into innovative practices across the homelessness sector at the time that include asset-based approaches, housing first, and of course psychologically informed environments. So further work with Fulfilling Lives. So during my discussions with Fulfilling Lives, I was introduced to Ray Middleton, who's one of the system navigators up here and an expert on PI, and you heard from him earlier in the day for those who were around first thing. I had several discussions with Ray, and he directed me to online PI resources, including a series of short films that explain the genesis, structure and potential impact of the initiative within the supported housing sector. I also had conversations with Westminster City Council. They'd successfully adopted PI within the contractual framework of their homelessness services. And I also engaged and learned from local PI-informed provision, including a provider called Oasis Aquila. One of the key elements of PI is staff training support, and to help facilitate this, I arranged for free CUF personality disorder training for support workers across the supported housing sector. That was arranged quite early on in the process. And during 2017, Ray regularly attended the ongoing co-production workshops and a significant market consultation event, which was at the back end of that year, during which he gave a presentation on PI, which included his Ladder for Life framework, which he may well have talked about earlier this morning. So we'll move on to sales, which has supported an independent living service for young people. So as the review progressed, the council decided that due to some of the deficits in local supported housing for vulnerable young people, which also including achieving a reduction in the number of looked after children placed outside of the borough, the new commission services should be focused on this vulnerable group. So after absorbing all the ideas and suggestions from the co-production working group and the wider consultation, a complete specification was written to design a new service for 16 to 25-year-olds with multiple or complex needs, which included the following clause. This is taken directly from the specification. So it says that the service will operate within a psychologically informed environment to help promote recovery, recognising the importance of reflection, open communication, the built environment and relationship building. The following key elements of PI will be incorporated within the service over a period of no more than 12 months. So that's managing relationships, staff support and training, the physical environment and social spaces, the psychological framework, and evidence-generating practice. New services were procured in early 2018, which included input at the evaluation of tender stage by 2 young care leavers, and the sales supported housing provision for vulnerable young people commenced in the summer of that year. It was a 5-year contract, 3+2, so 3 years. So it's due to expire in the summer 2021, but then we've got an option to extend for further 2 years after that. Next slide, please. Okay, so PI implementation. So once the 4 new sales providers were in place, PI training was arranged at the local Fulfilling Lives head office in Newcastle. Each provider appointed a PI coordinator who attended the training and was responsible for PI development within their service. The provider offering the psychological intervention service for young people opted out of PI development as they were using a similar clinician-led initiative called PIP, which stands for Psychologically Informed Practice, which aligned with PI and allowed for parallel monitoring. During 2018, each provider completed a self-assessment which covered 5 key areas: training support for staff, psychological awareness, reflective practice, the spaces for opportunity for our clients, and the 3 R's, roles, rules, and responsiveness to learning and inquiry. And following the self-assessment, each provider was visited and subsequently audited by Fulfilling Lives in respect of their PI response. Any actions that came out of that were monitored, and further audits are planned in 2021. So PI in action. So Gateshead Housing Company, low-level floating support. This is one of the 4 services that were commissioned. So the sales floating support service provided by Gateshead Housing Company offers flexible housing-related financial inclusion and well-being support for young people with medium to low needs. The service includes the offer of what we call a taster flat, council tenancy. The service adopted PI from the commencement of the contract, and in relation to PI, manager Carolyn Main confirmed regular supervisions and appraisals are taking place. The team continues to be close-knit and extremely supportive of each other. The team has had consistency, and consequently their knowledge of the processes and the young people within the pathway is excellent. There has been opportunity for staff to take advantage of one-off training, such as hidden sentence by NEPACs and PSA courses, and we have delivered bespoke training to staff, including professional boundaries, support plan training and SMART goals. The service has undergone a review of training records, and an updated essential training plan is in place. Staff attend regular housing services team meetings, which include various services within the department. We try to have regular guest speakers to enable staff to forge professional relationships and broaden their knowledge of services, both within the organisation as well as externally. Previous guest speakers have included Centrepoint and the Private Landlords Association, and drop-ins at Eslington, Alexandra and Poplar, there are 3 other services within the sales pathway, allow the team to stay connected to the other providers within the pathway. We've introduced weekly meetings in which we incorporate reflective practice. These sessions have been invaluable in gaining varying perspectives and sharing ideas and information. This has resulted in the services changing our processes around young people, in respect of ending taster flat tenancies and escalation for non-engagement of rent arrears. Policy is constantly evolving due to these meetings, and staff report feeling both supported and valued because of this. Reflective practice is also part of our supervision process for those issues where staff would rather it happened on a one-to-one basis. And we have listened to feedback from young people and have altered the colour scheme of our taster flats. Each flat is now standardised with grey carpets and black and grey furniture. Next slide, please. And then further PI action, Eslington House. So Eslington House is the front door of the sales service. It's a 20-bed assessment centre managed by Changing Lives and is located in the Teams area of Gateshead. The service adopted the principles applied at the commencement of contract and used a self-assessment to audit the centre. Referring to PI at Eslington House, the Young People Service Manager for Changing Lives commented, following his audit inspection, no actions were given by Ray at Fulfilling Lives to complete for Eslington, as the service itself is vibrant and has the facilities. Company policies are all in line and again are very person-centred, and we are using our learning to deliver tailor-made support. Staff are audited monthly on health and safety, support work, including a full file audit, participation, assessment completion, and the upkeep of their specific area of the building, as in the houses. I then audit Kaylee and Mel, who are the scheme managers, on the overall service. Along with this, all staff are encouraged to engage in reflective practice, so we are all committed to ensuring we deliver a PI service. The one area we must improve is case management meetings, which are normally discussed in supervisions. However, I would like fortnightly formal case management meetings that are time protected. Kaylee and Mel are to set this up, and chair meetings to discuss caseloads, risk management, and link to the Changing Lives theory of change. An area that is in development is the new Young People's Support Model Journey and Paperwork. I've co-produced this with young people, and I was due to deliver training to the team. However, lockdown 2 happened, so we are aiming to roll this out in January. This is more person-centred and much more friendly. Houses and the Health and Her Learning Hub with the newly built extension, which is still in progress, will be used as an outside cinema and seating area, and they were recently designed by young people with the staff. Next slide, please. Okay, so what you're looking at here is a couple of pictures from the PI-informed Eslington House flats. So as the manager said earlier there, all of the flats at Eslington House have been designed with in conjunction with the young people who live at their service at Eslington, and that's just 2 examples of 2 of the flats. And the next slide, please. And this is the Health and Learning Hub. So again, 2 pictures, one from the outside and one from the inside of the newly opened Health and Learning Hub. I think it's only been open for a few months, And again, this learning hub was designed with the young people who live at Eslington House. And then the final slide, please, Beth. Great, thank you. So I thought I'd finish with some quotes from 5 young people who are currently living at Eslington House about the PI service that they received there. So in terms of facilities, so there's 5 young people, as I say, contributed to these quotes. So I was worried about coming as I didn't know what to expect, but when I walked through the door, I was surprised and relieved. It is warm, welcoming, and I love how it has positive photos of people doing fun things around the place. I like the living areas, more so because we helped design them. It's how I want my house to be, proper, warm and comfortable. And the hub is the best bit about the place. It's a class place to chill, but also a good place to do my college work. And in terms of support work, I like the structure of it. Knowing I have a key work session motivates me to achieve my goals. My key worker drives me, but not in a pushy way. She's always talking about goals and advising me, but is always telling me it's my action plan, so I set my goals. And over the week, I work to achieve my goals with support if needed. Without this, I wouldn't be anywhere near ready for my own place, but I'm on path to achieve this. And finally, in terms of approach, I like how the staff are approachable. No matter what time of day it is, we know we can speak to staff and ask for support. All the staff are friendly, but are serious at the same time, always there to help, no matter how big or small. Even when I'd done something wrong, the staff reassured me I wasn't in trouble, but I had to learn from my mistakes to help move forward. After explaining things, I understood this, and I respect the staff for that. We can ask for things, and we know we will be listened to. It's like doing the surveys. I know the managers take them serious because I asked kitchen stuff in mine, and a few days later we had loads of new stuff. I like how the staff turn negatives into positives. I've never heard the staff talk negative. Everything is positive, and they're all motivators. Thank you.
Brilliant. Thank you, Carl. It's really interesting to hear about how you've worked with Fulfilling Lives and implemented the PI approach in the services, and I love the illustrated pictures. They look fabulous. We've had a comment from Lee who says, "Epic, Carl. This will hopefully be a preventative measure." So good comment there. Should anyone have any questions for Carl, now is your chance. We've got a couple of minutes before the next presenter. Carl, we've got a question that's come through from Grant. Grant asks, do you do any regional work on PI, or does each local authority do its own thing? It may not be all local authorities are as enlightened as Gateshead.
Yeah, it's a good question, Grant. Actually, it's individual local authorities is the honest answer to that. We, as commissioners, we work closely with our colleagues over in Newcastle, but in terms of the PI service at Sales, that was commissioned just by ourselves in Gateshead. But we do meet regionally as commissioners across a number of contracts. And certainly when I've gone to those meetings, I've talked about the importance of psychologically informed environments. So I think the message is getting out there, and I've also shared a lot of my learning from the process of setting these services up with colleagues in Newcastle and Sunderland and elsewhere around our region. But that's a good question. It is effectively, it's usually up to individual local authorities.
Brilliant. Thank you, Carl. Any other questions for Carl? Please do unmute yourself if you wish. We've got about a minute until we'll move on to the next presentation. Lee asks, are any of the support workers lived experience?
Yes, Lee, there are. There's one or two of the young people who have left the pathway and have thrived in their own tenancy, and then have come back through and are, if not support workers, then certainly involved in the running of certainly Eslington House, which is the front door of the service. So yes is the answer to that. Thanks for that question.
Brilliant, thank you. So with no further ado, I'd like to hand over to our final presenter of the day. So I'm going to close the slide pack down and hand over to you when you're ready, Paul. Carl, could I ask if you're able to turn your camera off? Because I think Paul's going to pop his camera on, so hopefully there'll be a switch. So over to you. Thank you, Carl. Over to you when you're ready, Paul. Sorry, Paul, I think I just unmuted you at the same time that you've done it.
Okay, sorry. Can you hear me?
Yes, I can see you and hear you.
Sorry about that. Sorry about that.
Right.
Thanks a lot. Cheers. Cheers, Beth. Okay, so I feel really underprepared because I've got no nice slide presentations. One, because I just didn't have the time, and two, because I'm really useless at putting things like that together. I'm a bit of a technophobe. So, and I was quite surprised when Beth asked me to do this, to be honest, and was picking her brains. What do you want me to say? I'm just going to ramble on. And she said, well, crack on. So that's what I'm going to do. So the brief was how to ensure those with lived experience are involved in the commissioning process, and the impact of involving people with lived experience in the commissioning process based on my own personal experience, and how other commissioners wanting to engage with programs such as Fulfilling Lives and Lived Experience would go about doing so. So firstly, I will say what I did think of doing was having one slide for this with a box, and the title of it was This is Not a Kickbox, because often when I hear about lived experience, commissioning, service user involvement, and all sort of anything to do with people who use services having any sort of input or influence on how those services are delivered or shaped. I hear that often. I used to hear it a lot more. I hear it less and less now about, oh, it's just a tick box exercise. And that really riles me, to be honest. And I suppose to put things in context, and I noticed from the comments here, not surprisingly, since the content of the day and what it's about. But I noticed from the comments earlier on, I think it was Lee said something earlier on, about workforces and people within workforces disclosing that they've had lived experience of whatever the issue may be, of multiple disadvantage. And that's how I got into commissioning. Initially, I had many years of using various services, from mental health services, drug and alcohol services, housing services, and I bounced around from about the age of 15, 16 until well into my 30s, and there's been a couple of revisits to those services as well since my 30s, and I bounced around getting support, some much better than others, from various services. And that's going right back to the mid-early 80s. So things were infinitely different then. But I was never asked in them early days how do you think services should be delivered. It just didn't seem to be a thing. And then about 11 years ago, I'd sort of done that progression that quite a few people do in sort of health and social care. I'd sort of eventually, with a lot of support and a lot of help, got my act together. I ended up going to college and got a few qualifications. I had none. I had no formal sort of education, really. So I ended up going to college, got a few qualifications, done some volunteering in homelessness charities and drug and alcohol charities, then got a paid job as a project worker, support worker, and sort of progressed that way. And then I seen a job in Bristol advertised, and I'd moved to Bristol, and I seen a job advertised for a service user development officer to work with the local DAT, sort of drug and alcohol commissioning team. And I went and I got the job. I really was surprised I got the job. And it had a service user group called UFO, User Feedback Organisation. But what I experienced was we had regular meetings with our service users, and what I experienced was that I felt the commissioners only took what they wanted to take from those meetings. Only things that seemed to suit and sit with a pre-arranged agenda did they take, and anything that was slightly challenging or slightly difficult or didn't fit their commissioning process seemed to get ditched. Anyhow, I stuck with the job for quite a few years, did it for about 5 years, and funding cuts kicked in and it gradually sort of fizzled out, unfortunately. Interestingly, quite a lot of the people who used to attend those meetings then moved over to our Fulfilling Lives sort of service user group down here in Bristol, called the IF group, which I was pleased about. So I carried on in that job, and I got another role as a sort of generic commissioning support officer, and then I seemed to be working quite a lot on the drug and alcohol side of things, and the team, we had to go through a recommissioning process, and I seen an opportunity for us to do some sort of innovative and sort of, you know, quite different sort of engagement work with service users. And what I'd found throughout the years of doing facilitating the service user group, was sometimes a difficulty getting past the providers to talk to the service users. That was quite frustrating. And also the message that we were getting from service users seemed to be managed by the providers quite often, which again found very frustrating. So what we tried to do for this commissioning process to get service user sort of engagement and to get lived experience and to really sort of have some meaningful conversations with people using services was to, you know, go to them, let us in, let us talk to people. We don't need you to be there, and let's see what it is they actually want. And we managed to do that, I think. And it was about going to people as well, making sure that we could facilitate and sort of put in place, you know, so people didn't have to come travelling into the city centre. So we did loads of meetings all over Bristol in lots of different venues for lots of different sorts of groups as well. So we did women's only, we did some LGBT stuff, we did some BAME stuff, we did all sorts of stuff that we could to talk to as many different cohorts of people and communities as was possible. And we got loads of stuff back from that. And I suppose the challenge then was about how do we implement this into the strategy. And one of the things is interesting in drug and alcohol stuff, especially, that's my thing, I suppose, is that there's been for many years, it feels like two opposing camps. And for anyone who's actually gone through the journey and experienced sort of problematic substance use, and that's how I refer to my substance use. It became a thing of a massive problem in my life to the point where it nearly killed me, very close to killing me. So it was a problem for me. But with the treatment of drugs, how people view, including Public Health England, including the government, including commissioners, it's such a massive topic, isn't it? Because it affects society so much, drugs and alcohol. So it doesn't just affect me as an individual, it affects those around me and society as a whole. To fund the drugs I used to like to take or had to take, was dependent on, and the alcohol, you know, I would do most anything, and it landed me up in jail in the end, and it landed me up in residential rehabs and hospitals and places like that. And I think that's something we have to consider when we're commissioning as well. It's not just about individuals, it's about the impact to society as well. So what I noticed in our previous round of commissioning, where I wasn't so involved, was that we'd focused very much on harm reduction, which I think is a massive place for harm reduction, huge place for it, and I probably wouldn't be sitting here today if it hadn't been implemented many years ago. But I think when we're talking about people facing multiple disadvantage, and when we're looking at the problems and the hurdles that sort of almost it feels at the time insurmountable, that we have to have a much more holistic approach than it just being about harm reduction Or the flip side of that, which people sometimes see, is abstentionism, where you're abstinent from all drugs and alcohol, and about it being a journey and about people moving back and forward, and a bit of this is good for someone at a certain time in their life. And the other thing I wanted to sort of bring to this is about, people have often said to me, oh, you don't mind talking about your past, your alcohol past? And I said, no, should I? Oh, no, it's either very brave or, oh, it's not all about you. And no, I don't think it is all about me at all. Why would you say that? Well, you've got to be careful. What I often say to that is, I'm not a therapist and I'm not a counsellor. And when I worked as a support worker, I didn't often disclose, because it wasn't about me, and the focus should be on the person who's there for support. What I do think is a fine line. I think that by some disclosure, you can show a deal of empathy and a deal of identification that adds to what I can bring to the role. And I do have an understanding, I think, of what it's like to be in some of those quite difficult, challenging, dark places that some of our service users can find themselves in. And then I think that also bringing that into a commissioning perspective is the fact that when we set up services, this is the crux of the matter here. And I think it's been brilliantly highlighted throughout the day. And I haven't really got anything groundbreaking to add, because it's all been said. There's obviously some fantastic work going on, and it makes my heart sing, actually. It's what I've been striving for about 30 years, to see this sort of thing take off. And what with a lot of other changes around the planet, it seems this is the right time to really give this a push and let people have a voice and not be told what to do and where to do it and what's good for you. So what I'm trying to say is that now, this time, service users having an impact, saying what's important to them, and what the main thing I hear in what I try to do is have continual conversations with service users, with people, the people who are using our services. Let's go and talk to them. We embed that in our performance management meetings, where there's a standing agenda item, and we want to hear from service users. They're welcome to come to our meetings. That's happened before, sometimes much more successfully than others. You have to be really careful, I think, because professionals tend to have this, and I do it, there's loads of jargon, loads of acronyms, and it can be, unless you're prepared to support someone, like you would another professional or anyone else coming into that meeting, and show them a deal of respect and support and say, this is what's going on here, and brief them and pre-brief them and debrief them afterwards. I worry about that. So what I'm trying to say is, what we continually try to have that, I hate the term, feedback loop with people who use the services. Yeah, so we're hearing what they've got to say, and it does shape our services. And the thing I hear nearly all the time is about, how can you make it easier for us? But I find it really difficult. And then I hear talk about referral pathways and stuff like that, and I think, oh God, here we go. And I look at it, and I get it from our providers and other providers of other services, and they send me these diagrams of these pathways, and it's triage, assessment, comprehensive assessment. It's this, it's this, it's this. And you think, I remember these days of going to this and finding it soul destroying, thinking, I just want some help. I understand you have to ask me some questions, but I just want some help. I don't want to go, I just seem to be answering question after question after question. Where does the support come in? Where does that happen? Where does the treatment start? Where does any of that start? I seem to be going through this, and it's us, isn't it, in our desperate need to gather more and more data constantly. We've got to feed some sort of beast. We've got to have that. We've got evidence this. We've got to do this, and the funding's all dependent on that. And I think that sets providers on edge as well. That sort of, well, we've got to give you, the commissioners, what you want, and us commissioners have got to give, for me, Public Health England, what they want. And it's this monster, and the focus and the onus for me is taken away from what we're all here to do. And I have to say that 90%, maybe 95% of the people I've ever met who work in this sector and work in health and social care are actually there because they care, they want to make a difference, and they care about people. And it's just the structures we've got in place sometimes I feel make that very, very difficult. And this sort of thing is breaking that down. You know, it's breaking down all those barriers. And like I said, I'm so pleased. So the way it informs our commissioning, for me, that constant dialogue with service users is about, I'm hoping that our treatment services in Bristol now are easily, it's easy to engage with them. You just rock up. Our Fulfilling Lives program down here, a part of that is the IF group, Independent Futures, and what they've constantly said is, we only want to tell our story once. We're sick of telling our story, and that really resonated with me. And we've tried to, where we can, one assessment will suit different things. And there's something else. I know Plymouth do it, and they do it brilliantly, and they've got an alliance down there of providers. And it's something that it's a vision I'd love to see in Bristol, where people could go and have all their needs met through one hub, or a hub in the north, a hub in the south, and a hub centre. We've got that at the moment for our drug and alcohol stuff. You can't just, I think, you talk about multiple disadvantage, and very often it's not just about drug and alcohol. So I'm going to go and get my drug and alcohol stuff sorted out, but I have to go here. Then I need to get my mental health sorted out if they don't exclude me because I take drugs and alcohol, which is another massive conversation about dual diagnosis or complex needs, or whatever you want to call it. But it's about, someone who's really, really struggling. I'm out in the street, in my sleeping bag, in a doorway, right, and I'm flat out on heroin and drink, and I wake up in the morning, and my concern is I'm ill, I'm sick, I'm really ill, I need to score. Yeah, if I've got a script, great. I'll go and pick up my script, my methadone or my buprenorphine thing, and that will stop me doing something kamikaze-like, and probably stop me going into jail for a while. And then once that's out of the way, I can sort of engage with the world to a certain degree. But once I've got my script, I'd want to go out and I'd want to probably go shoplifting, get the money to buy some drugs, go and have a hit, I'm out. But there is a window in there, I think, where I could be engaged with, and outreach teams can come and talk to people and make it easier for people, rather than you can go here, you can go here, you can see this person, you can see this person. Like I say, they do a brilliant job of this, I think, in Plymouth. But I would love to have something in Bristol where we can, you have a name navigator. We've talked about navigators a lot here today, where someone could be assigned someone who they could work alongside, who could facilitate and support them to get the help they need without having to, multiple appointments in multiple different venues around the city. How the hell are they meant to do that? And then, you haven't turned up to 3 appointments, sorry, we'll have to, kick you out of the service. And then you go round and round again. You just lose faith and lose hope. So, I don't know. I've got a pad here where I wrote loads of things that I was going to say, and I haven't said any of them. I'll tick off a few of me things. I've talked about that, and that. Yeah. I suppose the other thing I'm saying is about being brave as well, about when you do, a lot of my seniors in Bristol City Council are a little bit wary of my approach. Understandably so. They see some sort of, and hear some Phil Mitchell-like clone coming up to them asking, can we do it this way? Can we do it that way? Do we have to do this? And they're a little bit wary. But I do think there are enough people around, and I really do think attitudes are changing for the better. And I think we're engaging, there's a much more level playing field now, the way we work with people and not do to them, and we do with people, hopefully. That's what I'd like to think. And we work at their pace, and it isn't all about feeding the beast with the right data, the successful completions bit and all that. I've always, I cleaned up first from drugs and alcohol when I was 30. I'm 55 now. and they say, oh, you're a success, except for where I wasn't, where I relapsed or whatever you want to call it, and went for another year and then went back into services, and then they did another few years. Oh, you're a success again. And then I went, oh dear, you're a failure again. None of that's really helpful. It's been a learning curve. It's been my life. It's been a journey, and we've all got them. I just happen to incorporate mine into my job nowadays. Anyhow, that's it from me. It's been a pleasure. It's been a really good day listening to you. I love the stuff that's going on. And I just want to say thanks to all those involved in putting this on, especially Beth. Yeah, that's it from me. I'm happy to answer any questions I can, if you've got any. Cheers.
Paul, thank you so much for a really kind of inspiring, upbeat and energetic presentation to finish us off. Loads of positive comments coming in. We had an initial one, the comment box now, from Emily, who'd had a very similar journey to you herself. Lee, I remember your comment in the last webinar asking if there were commissioners out there. So here is Paul and Carl for you, and greeted by them today. And someone else, yeah, very inspiring. Someone called you visionary, so I presume it's better than Phil Mitchell. Has anyone else got any other questions for Paul?
Hello, it's Lee. Can you hear me?
Yes, Lee. Hello, mate.
Yeah, I'd just like to say, I think, it's because you've just kind of divulged having your own lived experience. And for me, the reason that was so engaging and resonated is because your vocabulary, your lingo, do you know what I mean? You kind of, I think that's what we need in services. We need to drop all this, like you said, all these, buzzwords, and let's make a massive thing that confuses the life out of everybody. And when you can read it and make sense, you've just kind of hit the nail on the head, haven't you, in a 10-minute presentation? I really appreciate your time, Paul. Thank you. Cheers,
Lee. Thanks, mate. I was going to say, Lee, actually, in that, I think I did write it down here somewhere, but I didn't pick up on it, about, like you said, about the lingo someone else has used, about some of the language that's used. It's really exclusionary as well. I struggle at times. I've got fairly good vocabulary, and I struggle, and I think, come on, let's talk in a language that we can plain, whatever it is that that person needs to hear. Let's talk in a language, whether it's English or whatever language that person needs to be spoken to him. Let's do it in a way that they can understand.
Yeah, you being down to earth makes you approachable, doesn't it?
Most definitely, yeah.
Brilliant. Thank you, Lee. If anyone else has comments or questions, please do unmute yourself if you would like to. Emily, I've just picked up a comment from you as well, saying it's inspirational to know what can be achieved. And I think that's kind of, it's been a key theme throughout the day of the kind of fantastic work that is going on. So, yeah, keep pushing this agenda, everyone. It's great to hear what is going on. Hayley agrees you didn't need a PowerPoint, Paul. Brilliant insight. Presentation. Thank you very much. A comment from Stephen Wallace. You mentioned a hub-style environment, and that worked well as so COVID. Once a week there'd be social care, housing providers, a sleepers team, DWP in a church where people could go and get good breakfast. So I'm working through comments, attendees, please bear with me. And yeah, similar have been Manchester with GMP and DWP. So successful brilliantly. This is what we need permanently. So that kind of multi-agency approach under one roof is really key. So, any final questions for anyone?
Can I just make a point from our experience in Blackpool during the COVID period? Is a lot of the public health commissioners got stuck in with going out and delivering food parcels, going out and supporting the lived experience team when they were doing their outreach on the streets and things. And I think that has changed their view of multiple complex needs hugely. and it was brilliant to see them, you know, literally rolling the sleeves up and getting stuck in with people. And I think maybe if commissioners took a little, you know, it was a great experience, I think, going through COVID and having everybody having to pitch in like that. But if that became standard, that commissioners did get stuck in a little bit from time to time, it would give them a real good insight into what the rest of us on the ground are doing and see what's what. So it's just a comment really more than anything.
Yeah, no, absolutely. Thank you for that comment, Bruce. I don't know if you have anything to add to that, Paul.
I 100% agree that when people actually go out there and see what people are experiencing, it sort of changes. You know, it's not. You can only learn so much from behind a desk, I think, or what you read on screen and stuff like that. If you actually go out there, it's that empathy thing, isn't it? Yeah, I just think, and I think it's great that people are willing to do that. I think the pandemic has brought a lot of that sort of mutual aid stuff out. It's brought the best out in a lot of people. So, yeah, I just agree with what was said.
Brilliant. Well, I'm conscious of time, so I'm going to have to draw today's session to a close, but a huge thank you to all the presenters. It's been a really wonderful afternoon, and to all the attendees for making really interesting and engaging throughout. There's been loads of fabulous comments, so thank you. If there's anything you'd still like to ask or follow up on after today, my email address is on the screen now, so please get in touch. Anything we can help with, we will. To keep up to date with kind of what's coming up, Rachel mentioned earlier, we've got the series of briefings around workforce development, so we tend to send them out on our newsletter as well, so it's a great way of keeping up to date with kind of latest publications and upcoming events in the future as well, and all the information for that is on the screen now. So all that remains from me is to say thank you ever so much and have a nice evening, everyone.
Thanks, Beth.
Thank you.
Thank you, everyone.
Thanks, bye.